Good afternoon, everybody. I hope you are wide awake. I'll be taking a talk on laboratory safety. Uh, it is very important to know. I'll just discuss. What is laboratory safety or biosafety? It is an active, assertive process based on evidence-based principles. And biosafety is done to ensure safety from microbial contamination or infection or from toxic reactions for the laboratory workers, the public, as well as the environment as a result of active manipulation of live microorganisms or their products or clinical materials while pursuing an academic or a research or clinical procedures. So this is a definition of a biosafety. So what is laboratory acquired infections? So laboratory acquired infections are defined as all the infections which are acquired through laboratory activities regardless of their clinical, subclinical manifestations. So it is very important. It could be the labs because we are being medical professions. We are dealing with a lot of clinical material, and we know that these materials could be infectious, containing infectious agents. So it is very important to know. So laboratory area contains biological specimens which are collected from hospitalized patients, both from in and outpatient departments and clinics. And some of these patients may be suffering from bacterial or viral infections. And we know that at present the COVID pandemic is on, and how much care we have to take to prevent infection. And most of you are already doing COVID duty, and already madam has discussed about the donning and doffing of PPE. So infections may not be discovered or confirmed unless these specimens have been examined or tested. So unless we test it, we will not know whether they are having any infective agents. So these specimens usually are handled by several staff of the hospital, and they may and these materials could be highly infectious and are while used for the processing of the samples for uh, um different laboratory tests. They could be toxic materials also. We use a lot of chemicals. It could be inflammables as well as corrosive, or even the equipments that are used are infectious or could be infectious. Each of these materials have a high risk while have their own risk while if they are handled improperly. So we have to know how to use these equipments, we know that how when we're taking the samples for COVID, how much precautions we are taking for sampling and for packaging and transportation, and how they are being transported to the laboratory for testing. So it is very important that we should know how to do the right technique to prevent any uh, occupational hazard or infections either to ourselves or to our co-workers or colleagues. So what are the goals of biosafety? It is to prevent infections in laboratory workers. It is also to prevent accidental release of live microorganisms, which can potentially endanger and have severe negative impact on human, animals, or in the environment. Now, looking at the epidemiology of the occurrence of laboratory acquired infections, you can see that in 1676, Leeuwenhoek, he was the first person who described bacteria. And by 1881-84, there was isolation and culture of diphtheria bacilli. And by 1898, you can see that while mouth pipetting, laboratory personnel got infected with diphtheria, or diphtheria laboratory acquired infection was reported. In 1883, Koch isolated the cholera vibrios or vibrio cholerae, and by uh, another decade or so, they had again reported cholera laboratory acquired infection. So you can see that over the years, typhoid laboratory acquired infections, brucella, all this have been reported. What are the most frequently reported laboratory acquired infections? These are, the most common is brucellosis, you have Q fever, typhoid, you have tuberculosis, you have fungal infections. Then there are other infections like coccidioido, histoplasma, and also some of the infections like highly um, fatal infections like hemorrhagic viral infections have been reported over the years. Now, what are the sources of lab-acquired infection? It could be inhalational, or it could be ingestion, or through ingestion, or through inoculation, or due to contamination of the skin and mucous membranes. So when you're working in the lab, because you are mixing different clinical material and using various equipment for mixing, that is for centrifugation or for grinding, vortexing, blending, and even using flaming a loop for um, inoculation, and these processes will generate aerosols. So you know about aerosols, was already discussed. While ingestion, there could be subconscious hand to mouth actions. So many a times we do not realize that we have touched infected surfaces, or while handling we touch our mouth or the eyes and we get infected, or placing contaminant articles into the mouth, like using a pen or pencil or fingers into our mouth. Inoculation. Inoculation could be parenteral inoculation of infectious material through accidents via the needle stick injury or using a blade or a broken glass. Whereas contamination of skin and mucous membrane could be while doing a procedure, there could be splashes of the blood or serum or clinical material into the mucous membranes of the eye, the nasal cavity or the mouth, or the hand to face actions may lead to the transmission of these pathogenic microorganisms. Now, what are the rules and safety precautions? Now, the rules for handling laboratory specimens and materials should be meaningful, and these rules should be clearly written, and strategies for collecting or analyzing and disposing of laboratory specimen must be well defined. These rules must be carefully explained to newly appointed staff or the newly appointed members of the laboratory, and whenever the rules are laid, all members of the staff should be appraised of these new rules, or they should be made aware of. So this very fact that this foundation course is going on is to give you a brief or overview of various procedures or the training that is required. So this is how the foundation course has been started. Now, what are the aims of the rules and the safety precautions? It is to establish the policies which ensures the safety of the staff, the patients, as well as the members of the public and the laboratory area. To protect the laboratory staff against unnecessary exposure to infectious agents and to avoid cross-contamination or sickness, any injury, or even other hazardous uh, occurrences like a fire, electricity, mechanics, chemicals, or lasers. It is also to offer immediate information for dealing with unexpected threats to the well-being of the laboratory staff as well as the patients, and to prevent the damage of physical assets such as the buildings and equipments. It is very important that because all equipments uh, are used through electricity, it is important that many a times they could be short circuit and they could be damage to the equipment. It is very important that even electrical equipments are used well. To raise the awareness of the staff of the importance of the safety rules as well as to take all precautions. Now coming to the biosafety levels, what is this BSL? So this biosafety levels, they correlates to the biohazard groups. So this biosafety levels, or the biohazard groups, describes the containment practices, the equipments and the facility design features which is recommended for safe handling of microorganisms in a different hazard groups. The National Institute of Health and the Centers for Disease Control and Prevention, USA, define 4 levels of biosafety in the microbiological or biomedical laboratory. These guidelines are referred to as biosafety levels. And there are 4 types of biosafety levels. 1, 2, 3, and 4. Now coming to the biosafety level 1, this means the lowest level of containment or microbiological safety entirely based on standard laboratory practices. It is recommended for work with microorganisms that are not known to cause infections in healthy adults. Like examples, Bacillus subtilis. So Bacillus subtilis could be found in the environment. They are not known to cause any infection in healthy individual. There is no risk or low risk to individuals as well as to the laboratory workers and the community. So biosafety level 1, this is the lowest level of containment. Now, what is biosafety level 2? This generally applies for bacteriology laboratories during the work with agents like Salmonella species. We know that Salmonella are known to cause enteric fever. There are different types. It can cause septicemia. It is associated with human disease of varying severity and agents of infections that are unlikely to spread in the community. So a person usually will not spread the infection to others. These agents can be handled on open benches, especially if the primary barriers such as face protection, gowns and gloves are used when appropriate. And in such infections, effective prophylaxis or effective treatment is available. So you can treat these infections. Coming to the biosafety, this is the containment of hazardous microorganisms primarily transmitted by aerosols such as Mycobacterium tuberculosis or Coxiella burnetii. So these cause very severe human diseases. Serious hazards, these agents cause serious hazard to laboratory workers, and there is also a risk of spreading of this infection in the community. However, there is sufficient prophylaxis and the treatment is usually available. Specific requirements are needed, like suitable ventilation systems to process the samples in a BSL, where totally it is enclosed cabinet with gas-tight construction, which provide highest possible level of protection to the person who is working as well as the laboratory environment. Now coming to the BSL 4, to biosafety level 4, this level is for agents causing life-threatening or untreatable diseases that can affect laboratory workers via aerosols. Example is hemorrhagic fever viruses like Ebola, we have Marburg, we have COVID, and other highly infectious like SARS, MERS. These are all highly infectious agents. Usually they are viruses and they present a very high risk of spread in the community. And there is no effective prophylaxis or treatment. Especially for hemorrhagic fevers, there's usually 100% mortality or it is fatal. The personnel must wear suits that cover the full body. It should be air supplied and positive pressure suits are to be worn. This facility itself should be isolated from other laboratory and includes a very specialized ventilation and waste management. So everything there, whatever waste is generated should be disposed of in that area itself. So normally a BSL 4 is one it cannot be located close to the other laboratory facilities. Now talking about the biohazard sign, this label can you see is the biohazard sign. It is a universal symbol. It communicates of potential exposure. It is typically a red or orange color. The symbol should be defaced when the hazard is no longer present. Should be used sparingly and explicitly and usually used for cultures of pathogens or clinically infectious materials like human blood and tissues or equipments which are used to process these clinical samples or storage areas or fridges or deep freezers for the storage of these clinical human clinical materials. It is also used for animal experiments. So the cages can be again labeled and door into a laboratory. So laboratory, because any sample could be infectious, therefore this label is also placed at the door of a laboratory. Restricted entry is, there should be restricted entry into this laboratories. Now coming to about the talking about the biosafety cabinets. What is this Biosafety Cabinet? It is a device that encloses workspace in such a way to protect the workers from aerosol exposure to infectious agents. There are three classes according to the degree of biological containment. There is class 1, class 2 and class 3. Class 2 has class 2A and 2B. We will just discuss them. In class 1 biosafety cabinet, this is a schematic diagram. It allows the room air to pass through this cabinet, and there is a particle protection factor, and the sterilized air is exhausted. So you can see that the airflow goes into the cabinet, and finally there's a HEPA filter, and then the exhausted air is sterilized air is exhausted out. Coming to class 2 biosafety cabinet. The sterilized air that flows over the infectious material, because the clinical samples are kept inside the cabinet, as well as the air that is exhausted are sterilized. So this is a schematic diagram. There are two types. Type 2A, that 70% of the air is recirculated, whereas in type 2, the exhaust air is discharged out to the outside environment. Especially these are used for handling radioisotopes or toxic chemicals or carcinogens. And you can see in class 2, there's a variable sash openings. That is, there's a sash which goes up and down, and the laminar flow biosafety cabinets, they're known as laminar flow biosafety cabinets because the air flows in the sheets. You can see the airflow diagrams that is shown here from the outside into the cabinet, and they directly flow over the contaminant air into the filters. So do you have two HEPA filters here, and the final air of sterilized and filtered exhausted out. Coming to the class 3 biosafety cabinet, it is a completely enclosed with a negative pressure. Air which is coming in and going out are both filter sterilized, and the infectious agent is within this box is handled with rubber gloves that are attached and sealed to the cabinet. So here we are dealing with highly infectious materials, and here the materials, there's an opening here where the clinical material is passed into this, and then this whole thing is sealed, and then the whole manipulation is done through these gloves. So this is dealing with highly infectious material agents. Now, how will you care for this biosafety cabinets? So usually disinfection is done of this bench top or the biosafety cabinet top, and they are usually disinfected prior to work or before starting the work and after work with 70% alcohol or with 1% hypochlorite. Sometimes the hypochlorite can cause corrosion, so you can use other methods for disinfection, and special precautions are taken when there is any spillage. So large spills and small spills, again, you have to take care while working in the biosafety cabinet. And you can also do fumigation, that is before the maintenance or change of the filters, and routinely at least weekly intervals they are fumigated. So it is important that these, even there's a UV lights there, so you can use the UV light, switch on the UV light for at least for 15 to 20 minutes, after which you can start your work. Now, what are the essential for standard precautions and safe laboratory work practices? It is very important that when you're in the laboratory, one should not eat, drink, or smoke. They should not insert or remove the contact lenses. Like touching the mucous membranes are because the surface areas could be contaminated. Do not bite nails or chew on pens. And mouth pipetting now is totally absolute. Nobody does it. We have mechanized pipetting systems. And the access to the laboratory should be limited to only trained personnel. So not everybody can walk into the laboratory because we do not know what is there, what infectious agents are there. So it is important that only trained personnel, those who know about the laboratory should be allowed access. One should assume all patients are infectious for HIV or any other blood-borne pathogens. As we know, all or none, unless they are tested, we will never know whether the person is harboring any infectious agent. Now, as Madam has already said, you should wear appropriate personal protective equipment. So normally we wear an apron. The apron helps when we come in contact with infectious inanimate equipments, or any spillage or any splash can be protected through your apron. But in specific procedures, when you're going to perform specific procedures, then you should wear the PPE. So as already you people are wearing for COVID, so while doing the duties for COVID, in the laboratory also, because while processing any sample, infectious samples, then one should wear the protective equipments. So the donning and doffing of these gowns and should be known. Everybody should know. Any person working, in fact, should know how to don and doff the PPE. That is involving the gloves, the mask, the goggles, the gowns and aprons, and these should be removed before leaving the laboratory or the area where the task is being performed, and discarded into color-coded bins. I think somebody will be talking about biomedical waste management. It is very important that this biomedical waste management should be followed. So can anybody tell where to throw your gloves? Which color-coded bins will you throw your gloves? Discard. What about the goggles? Anybody? So biomedical waste management is very important. So everybody should know. So the site segregation at the site of generation is very, very important. So uh, whatever waste you generate, you should know where to discard them. So as we know, gloves, rubber, all rubber and goggles, plastic goods are usually discarded in the red bin. Okay, whereas aprons, if they're usually plastics, they're highly infectious, so they usually go into the yellow bin. Okay, all infected materials should go into the yellow bin. So use biosafety cabinet for procedures that generate splashes or aerosols. Deposit the sharps in special puncture-proof containers. So where will you discard the sharps? Again, you have the white bin. So in the white bin, you can discard the sharps. Decontaminate your work surfaces daily, and if there are any spills. Comply with hand disinfection procedures by using alcoholic hand rubs, or you can use the soap, medicated soaps or ordinary soaps also you can use. I think Madam has already discussed this about hand. Anyway, I will discuss about the hand hygiene. Now, hand hygiene, according to Rotter, hand hygiene is the single most important practice for preventing nosocomial infection or healthcare associated infections. Now look at this diagram. This is on the right hand side, you have the front of the hand, and in the left hand side, you have the back of the hand. So these red areas are the most frequently missed areas of the hand, the front and the back of the hand, whereas the less frequently missed are the ones which are colored in purple or which are in beige or colorless. Can you see these are the part? That is the reason why proper hand hygiene or hand wash procedures are very important. So how do you do since you're already doing the COVID, everybody now knows how to do we have also taught the residents and faculty how to do the hand wash, hand hygiene with the hand rub. So it is very important that minimum of 10 to 20 seconds of hand wash, and then it should be dried immediately. So there are procedures. Now coming to when should you wash your hand? Hands should be washed when they're visibly contaminated with blood or body fluids, using soap and water or using any antimicrobial soap. It should be washed while before eating and after eating, after going to the toilet, and moving from a contaminated to clean site. So you should clean. So it is important that hand wash should be, or hand hygiene should be done when you're moving from a contaminated to a clean area. If the hands are not soiled, then you can use alcoholic hand rubs for routine hand hygiene procedure. Now, a little about immunization. Now, immunization provides protection against some laboratory-acquired infectious diseases. They may not prevent, but however, they can protect against serious illness or serious disease. There are vaccines which are available for some of the bacterial viruses. So these are the hepatitis B virus. How many of you have been vaccinated? It is very important to be vaccinated. And since the vaccine is available for hepatitis B, which is one of the most infectious agent, it is more infectious even than HIV. So after that, you should make sure that after your booster, you should also check for your antibodies. So you should have the protective antibodies. Many a times people do not seroconvert. So it is important that you know the antibody titers. Minimum of 10 international units, that is the cutoff. Then influenza. Influenza, we know that people take vaccination for influenza A, for B, and also for swine flu. Then tetanus, you have diphtheria toxoid, meningococcal, rabies, both for post-exposure prophylaxis or as a preventive measure also you can take. And you have vaccines for like typhoid and for smallpox, as well as for measles, rubella. So these vaccines are available. So it is important that as healthcare workers, you should make sure that you are immunized for hepatitis B. Now, what about the accreditation of laboratories in India? The NABL, which is a national accreditation board for testing and calibration of laboratories. It's a very stringent criteria, and it is an autonomous body against the aegis of DST, the Government of India. And this is the sole accreditation body in India. And these accreditations are done based on the internationally accepted standards and guidelines. So this is to bring about uniformity in your reporting and the procedures which have been performed in the laboratory. To summarize my talk, laboratory personnel are at high risk of being infected by agents which they handle in the laboratory. They could have exposures to infectious aerosols, and which is considered the most common source of infection. And we have to assume that all patients are infectious for HIV or hepatitis, as I've already told you. And we need to strictly adhere to the biosafety procedures. We need to wear appropriate personal protective equipments. So when we require, we should wear many times we wear only the mask and we wear the gloves. But it is important, as and when required, you should wear the PPEs. Hand hygiene is the single most effective practice to prevent infection. This I'm saying because if your hand is, especially for MRSA, VRE, Candida auris, if your hands are not properly washed or clean, then you may start spreading the infection from your hands to other patients. That way you can have an outbreak of these hospital acquired infections in the hospital or in that particular ward. As I've told you, vaccination can help prevent some of the infectious diseases, and following the guidelines can reduce the risk of exposure and consequently the laboratory acquired infections. With this, I finish my talk. Thank you.